Recording this message to explain why it is important to pay attention to government's advice during COVID-19 pandemic. I am acute medical consultant. I'm working in Southwest London Hospital. I admit patients when they attend hospital for COVID-19 related illnesses. My work life has significantly changed since COVID-19 pandemic. COVID-19 is a new virus, and when we see people with serious illness, it scares us. We have never seen any illness which makes the patient deteriorate so quickly in front of our eyes. This illness has mentally traumatized many clinicians. It is so contagious that 80% of the consultants and junior doctors in the infected areas have already been infected with the virus. In fact, you may have heard in the news that more than 20 NHS staff have already lost their lives. There is an international shortage of personal protective equipment, and oxygen supply in hospitals is now becoming an issue. In fact, this virus has proven stronger than the mighty of all human advancements. Most of the patients coming to hospitals now have COVID, but still there is no treatment. We literally do not have anything other than oxygen to use until they can no longer maintain their breathing, at which point patients are put on a ventilator. If you think following government's advice of staying at home is lonely and difficult, think again. People who develop serious illness to the stage when they have to call the ambulance, it is at that point when it becomes really difficult and lonely. Patients are brought to the hospital on their own in an ambulance, and every patient, when they are admitted to the hospital, doctors are expected to assess whether they will be suitable candidate for a ventilator. I have seen doctors telling the patients that it is time to go on a ventilator, but warning them that they may never wake up again. Some patients are not even given a chance to say goodbye to their family, and it is only after the patient have been put on a ventilator that the family finds out over the phone that their loved one has been put on a ventilator. And even if the disease is not serious enough for someone, there is a risk that it may still result in a long-term lung damage, which means that the life will be not the same again. And believe me, COVID is a cruel disease. If you think you are young and strong, although there is no guarantee that you will live through this pandemic, but even if you are lucky enough to not have the serious illness, you people around you, your parents, your family, they may not be lucky and strong. So please remember the government's advice is very loud and clear. Stay at home. This is the best advice, and it stops there. Stay at home. Yes, you are allowed outside for essential buying, for healthcare reasons, or to care for someone else. But you are compromised as soon as you leave your home. You must keep 2-meter distance from everyone, and you must not touch your face until you have washed your hands for 20 seconds using a soap. And if you do all these things, you do not completely eliminate, you only minimize the risk you have taken by leaving your home. So please do not take any risk unless you have to, and stay at home, and do not meet any family or friends, as they can have illness without the symptoms. So please stay at home, protect the healthcare system, and save lives. Thank you.